So the warning signs of stroke are fairly easy to remember and should be something that all of us know in both the public and in the medical community. The way I always teach people to remember this is the word FAST, which is F-A-S-T, 4 letters to remember, and each one of those letters helps you identify certain signs and symptoms of a stroke. F standing for face, which is asking the person to smile or to move their facial muscles. And if one side doesn't work, that's a strike against them or a warning sign for stroke. The next letter A is for arms, and you ask the person to raise their arms. If only one arm can raise, or if one arm appears to be heavy or difficult for that person to raise, that's strike 2 or another stroke warning sign. The third letter in the word FAST is S, and S stands for speech, and it's as simple as asking the person to say a sentence. I tend to ignore or try to avoid using the person's name when we ask them, because sometimes they can still say their name when having stroke-like symptoms, but if you ask them to repeat a sentence, many folks will have difficulty doing that, and that's your third warning sign. And then that last letter, T, which is if you've identified these symptoms, even if you've identified one of the 3 letters we've just talked about, you should think T. Think about calling 911, or take action is another way to use that T word. If you have one of the 3 of those stroke symptoms identified, you have a roughly 70% chance of successfully diagnosing a stroke in someone or a loved one. If you have all 3 of those present, you have over a 90% chance of being accurate in diagnosing stroke, and that last letter is so critical, which is take action or think about calling 911 right away.